Hi, my name is Amanda Panacea, and you're listening to the Healer Revolution podcast. This is a community for self-healers, biohackers, practitioners, and any other helping professionals. You're in the right place if you're seeking conversations about how pain becomes passion, the connection between physical, energetic, mental, and our spiritual self, finding your body's ancient wisdom, the latest biohacking technologies, clinical research, and if you just want to nerd out about complex biochemistry and quantum physics. But this is also for entrepreneurs who seek infinite abundance and a supportive community. So pour a cup of King coffee or Sisters tea and let's join the revolution. Hello, friends, and welcome to the Healer Revolution podcast. I am your host, Amanda Panacea, and today we have a really special episode with Dr. John Kim. I am ecstatic to have him on the podcast because he knows more about phospholipids than anyone else that I have come across. And so I had so many questions on how phospholipids can help heal from chronic illnesses, the importance of phospholipid balancing and the difference between these versus other types of fatty acids. So this is a really, really deep and heavily on the practitioner lingo and clinical talk episode. But again, really jam-packed with little tidbits that are going to really help you in lots of different ways. Dr. John Kim is a functional medicine pharmacist. He has his doctorate of pharmacy from Rutgers University with high honors, and he also received his training in functional medicine from A4M. He also lectures throughout the country and is an influencer within the functional medicine world. He helps educating and empowering everyday people to live healthy, fulfilling lives. He also is an advocate for medical freedom. He owns and operates Robinson Wellness Pharmacy in New Jersey. And his message to all of us is the doctor of the future is you, meaning you are the doctor of the future. So I hope you like this episode as much as I did. Enjoy. Hello, everyone. I am your host, Amanda Panacea, and this is the Healer Revolution podcast. I am super excited today to get to interview Dr. John Kim. Hi, Dr. John. How are you today?
Hi, Amanda. Thank you so much for inviting me. It is an honor to be on your show and excited about this interview.
Yes, me too. I'm really excited to hear your story, not only for its uniqueness, but also because you have a level of education in some areas that I'm really not familiar with. So I'm sure I'm going to have a lot of questions, and I'm really excited to get to know you better.
Absolutely. I think everybody has a unique story. I think it's what kind of path you're leading, and as well as where you're going is really important.
Mm-hmm. Yeah, completely agree. So let's jump right in. How did you get into medicine? What was your big aha moment where you were like, this is what I'm going to do?
So I'm a compounding pharmacist by training. So I graduated from pharmacy school back in 2006. And during that time, I went through the overall, all the didactic lectures and working under some great pharmacists and great pharmacies, and as well as I did research as well. So I have 2 publications done in looking at cancer studies and looking at EGCG, one of the polyphenols in the green tea. And I thought I was going to go into some type of research. Unfortunately, working with mice all the time just bored the crap out of me. So I was looking at other things. And during my clinical rotation, worked at several compounding pharmacies where it really gave me an opening eye of possibly owning a pharmacy and looking at expanding something called compounding itself. So people out there don't know what compounding is. So compounding pharmacies, they actually have a lab that we actually customize medication based on the patient's needs. So where this actually fits into is customizing bioidentical hormone replacement therapy, low-dose naltrexone. So people out there dealing with Lyme disease and chronic pain, low-dose naltrexone can be very helpful. Autism spectrum disorders, we compound methylcobalamin injections and all that. So compounding actually, it's not the normal practice, but it's really able to customize a lot of therapies for patients and doctors who are into functional medicine. So that's the reason why I wanted to get it. But one of the aha moments I had was that I was working in the ER as a ER pharmacist, and I had this one particular lady who came in with an uncontrollable high blood pressure, and the 5-week rotation that I had done at the hospital, she was there every week. Blood pressures escalated, and the only thing we ended up having to do was just keep on increasing her dose, and nothing in terms of her dietary changes or lifestyle changes, nothing like that. And it was just a revolving door of the same patients coming in. So that's where I said this cannot be going on like this. I mean, even when I was going through my clinical training in pharmacy school, we looked at the JNC7 guideline, which basically was the hypertension guideline that all clinicians use. And a number of things that we ended up having to recommend was to doing DASH diet. I'm not sure if they still use it or not, but it was basically to change their person's diet, lowering salt intake, lifestyle measures in terms of losing weight, all that, then thinking about using medications. But nothing was actually discussed with that. And so I said, this is such a disconnect. What is going on? And so I wanted more answers. I was working for one pharmacist who actually did this type of integrative training that, I mean, I'm doing a lot more now, but what he was doing was he was seeing patients dealing with weight issues and hypertension and cholesterol issues by doing lifestyle changes and doing nutrition, and he was having some phenomenal results. And I noticed that patients would drive 1 to 2 hours just to see him. So that's where I was able to get mentored by him, then went through several others. And I think we have some mutual friends. I don't know if you know Dr. Bob Rokowski.
Mm-hmm. Yes, of
right?
course.
I was this one cocky pharmacy student doing an internship down in Houston, Texas. And he was the one of the speaker on stage talking about inflammation and looking at cholesterol levels, and all the things that he was saying was completely opposite from what I was learning in pharmacy school. On top of, he talked about coffee enema. I'm like, this guy's nuts. This guy's completely nuts. And so I went back to my hotel room where I was staying at that point in time during my internship. And I did more research. I asked more questions. I'm like, this guy's completely nuts. I got to find out what he's talking about coffee enema. And to this day, I don't think there's enough studies on coffee enemas available. But that really made an impacting moment for him to humble me like that and seeking more answers. And by that, I decided to do my fellowship in functional medicine right after pharmacy school. Worked at a compounding pharmacy for 6 years, building up the practice from scratch. And then afterwards, I decided to buy my own pharmacy back in 2012. But during that time was basically learning moments of doing hormone replacement therapy and looking at certain labs, especially salivary hormone testing, and assessing patient clinical needs, along with all the things that I was doing that really set the foundation that I needed. And I continued doing that, but life always ended up having to throw a curveball at you. And a lot of the things that I'm doing now just led to what I had experienced, during my health crisis that I had back in 2015.
Yeah. So what is this health crisis?
So I had a heart attack at the age of 33 years old. I had an 85% blockage in my lower anterior descending artery, aka the widowmaker. And that came out of nowhere. I went to a wedding event in LA, came back 3 days later, I was having heartburn. I thought it was a heartburn. Actually, it was a chest pain that I was walking around for 48 hours.
Wow.
And the pain got even more intense. I call myself the foolish person for waiting that long, but I thought it was just nothing. And I just couldn't accept the fact that I was having a heart attack. I kind of knew I was having a heart attack, but I ended up going to an urgent care center, and they did an EKG, and they found that I was having a heart attack at that point in time, and I was admitted to the hospital right away. And even that time, the attending physician and the ER could not believe a person who was, at that point in time, I think I was doing CrossFit, running all the time, very physically fit at that point. And I had a very clean metabolic panel as well, and I thought it was in a top shape and such, but no, I had a heart attack. And that's the reason why the doctor didn't believe me. The risk factors and the normal signs and symptoms of a person who's having a heart attack was not there. The troponin level was less than 1, so there was absolutely zero damage in the heart. But when they did the echocardiogram, my left ventricle wasn't pumping correctly. As a result, they put me in a cath lab and they found that I had an 85% blockage. So I had a stent put in right now. I'm still having a stent, obviously, and yeah, that's what happened. I ended up in a ICU unit for 4 days, followed by sitting at home for 2 weeks, questioning, what happened and how does this occur when I thought I was having a good life and at least clean eating process, which I thought it was clean, but it wasn't.
Yeah.
And that's the problem too. And all this didactic training that we go through as a functional medicine providers, we think we're doing everything else, but all in all, it's moments like this that end up having to really humble you and teach you the process that really opens doors of how you view things in a bigger scale and how you could actually make an impact in your life and as well as your patients. So that ended up having to be a changing moment. And that led to, getting to my own personal doctor and asking questions. And she thought I was dealing with some type of a tick-borne related illness. That's when we did the IGeneX testing in several other labs. And I had Bartonella infection followed by mold toxins. Then we actually had parasites, heavy metals, and such. I had very high levels of triclosan at that point in time. That's also affecting microbiome, but several other things. And then we also did some fatty acid analysis to see how bad my mitochondrial function was doing, and it was awful. It was awful. So that put me in a tough bind in terms of getting off work for almost 4 months, trying to get treatment done properly. And I was almost bedridden almost every single day, trying to question in terms of whether this is a right path to doing or not. But it took me 2 years, two years to clear up Bartonella infection, including mold and parasites. And I was able to get my life back. And then after that, my overall shift has been really helping patients dealing with tick-borne related illnesses and other biotoxin issues. So yeah, that's that. And I know you do a lot of bioresonance testing, but the first thing that my doctor had done is she's an MD and she actually had a bioresonance testing person in her office. And she had this, still forget what the machine is called, but few practitioners actually have it. It's just one of the electrodes that you hold into your hand, and then the other second pinpoint goes to the other finger. And man, I had a lot of beeping noise going on, especially emotional burden, Bartonella infection. I'm like, Bartonella? I'm like, there's no way. I'm like, what is this machine first off? And then sure enough, the clinical labs come back and just said, you have Bartonella infection.
Yeah. Wow. What a story. Yeah, that's amazing. Well, I'm so glad that you're still here and you've used that, turn that around to give back and help other people. Would you mind explaining what Bartonella is?
So Bartonella is a tick-borne related illness. It's, everybody thinks about Lyme disease, but Bartonella is actually very prevalent, actually a lot higher, I think. And I see more Bartonella popping up after patients dealing with COVID-19 infections. And so these are some of the things that can actually occur. And one of the things about Bartonella is that it is an intracellular infection.
Have you had to give up coffee for health reasons? Maybe because of the stress it was putting on your adrenals, maybe because it was messing with your sleep, maybe because you felt terrible after drinking it, or maybe because you were told coffee had mold on the beans and you needed to stay away from mold. Well, what if I told you there's an organic, mycotoxin-free, quality coffee that contains reishi spores or Ganoderma lucidum? Ganoderma lucidum helps to modulate your immune system, adapt to stress, balance hormones, and doesn't give you the jitters or shakes like regular coffee used to. Sounds too good to be true, right? It's called King Coffee by the company Organo. And King Coffee came into my life when I was struggling with chronic hives, full body eczema, and mast cell activation syndrome. I hadn't drank coffee in years because it made me feel anxious, shaky, and clammy. So I had no expectations that drinking King Coffee would be any different. However, I decided to give it a try after seeing lots of amazing practitioners talk about the benefits of reishi online. I tried a 7-day sample and the chronic hives were gone by day 5. I was in shock. After that, I dove into the research on reishi and found that there are over 3,000 peer-reviewed PubMed clinical trials using reishi Ganoderma as an intervention. The company Organo also has a patent protected on their harvesting process. They double crack open the spore shells, which makes them up to 80% more potent than the body of the reishi, which is usually used in other reishi products. This also makes the spores 90% more bioavailable for your body to use. If you would like to try King Coffee, visit thehealerrevolution.myorganogold.com, or for a 7-day trial, you can check out my link tree on my Instagram at Amanda Panacea. Okay, so we were chatting about Bartonella. What is Bartonella?
Yeah, so Bartonella is another tick-borne related illness. Everybody thinks that Lyme disease is very prevalent, but Bartonella is another thing, including babesia. You have rocky spotted fever, all that. I mean, there's so many going on. But Bartonella actually is a particular tick-borne related illness. It actually attacks a lot more intracellularly, as well as the fact that the unique thing about Bartonella is it's so hard to grow in the lab. And it results in a false negative that's coming back a lot of times. So you need to work with a specialty company to really assess that. And by all means, some practitioners end up having to use both a specialty clinical lab and as well as using bioresonance testing to looking at whether Bartonella is really present. But Bartonella can cause major issues in terms of almost like a very stealthy infection as well. It hijacks the immune system, quote unquote. It also attacks some of the inflammatory tissues. So if you actually have, for give you an example, if you actually have a inflammation that's going in your knees, that can majorly throw off the issue in terms of developing into potentially like rheumatoid issues, all that. It affects the endothelium tissue as well. So for me, I probably had endothelial damage, which led to having atherosclerotic plaques and other things to get involved in developing an atherosclerotic plaque. Bartonella can also cause major neurological issues, seizures, OCD, depression, you name it, all that. It can also be colonizing in the urinary tract as well. So they've been seeing Bartonella in some of the samples I've seen in the vaginal tissues and such. It also can be transmitted sexually. So it's not a simple thing. And one of the interesting is that I mentioned about the neurological issues. I think the given point of what's happening within the mental health aspect, especially talking about the homeless population, and that particularly is having a lot of mental health issues. I think they did a study back in, I think 2004 in a population, LA homeless population, and LA homeless population, almost 80% of them had Bartonella quintana as an infection. So that's a major, major point that can actually cause neurological inflammation and mental health, schizophrenia, depression, anxiety, all that. So, I think there's a major, major epidemic issues that we're not really looking at because a lot of practitioners are not trained to look at these infections correctly, nor do we have the right labs, or at least to teaching the clinicians to order the right labs to identify these pathogens correctly and then treating them. And then there's a whole hidden issue of health equity issue, right? Because not everybody has an access to functional medicine providers like ourselves to look at these in a bigger way and treat them at the root cause. So a lot of brokenness in the health system, but yeah, that's the little bit of a summary on the Bartonella infection.
Yeah, I used to work in psychiatric hospitals. I was a licensed mental health counselor. Well, I still am, but no longer practicing in that. But even back when I was like choosing to go back to school for functional medicine, I was still working in the hospital system, and you could just see like, this is very classic Lyme. This seems like Bartonella.
Yeah, absolutely.
This seems like parasitic infections. And so I was, of course, asking all these people if they'd ever heard of any of this stuff, and nope, Not a single person, not a single nurse, not a single psychiatrist, just really not on the radar.
Yeah, and the common symptoms I also see is patients dealing with pain. So neuropathy is a
Mhm.
big one that I see. So if you actually have a neuropathy flare, usually interconnected to Bartonella flare that may be happening. So that could be one thing, and I see this as a almost like a double symptoms popping out at the same time, either some kind of anxiety, OCD symptoms, plus fibromyalgia or some kind of pain issues, nerve pain especially.
Mhm. Yeah, totally agree. And so let's get back to your story. So after this heart attack, were you determining like, oh, I was living in mold, or did you ever figure out what a trigger was?
I was in Boy Scouts all my life, so who knows who I got that infection.
Mhm.
So that could be a contributing factor, but my house I grew up in was very, very moldy. We never think about how certain basement flood can actually affect, and maybe a black tardy substance that's actually growing on the side of the wall can affect you. But that was it. That was basically the risk factor that was all around. But when you are not knowing what the risk factors are, what to look out for, everybody makes that kind of same mistake, and that's where I grew up in. So cardiovascular disease wise, there's a huge connection of mycotoxins and mold along with cardiovascular issues. So there's been major studies looking at, so I'll give you a perfect example. I have a patient right now who actually had developed DVT from mold toxins. And with her, it has been very difficult to take care of because she couldn't utilize any other thrombotic agents, and so they end up having to put her on warfarin. And warfarin, for instance, is depending on the microbiome status. So when you actually have a mold toxins, especially trichothecins, can actually cause both a bleeding and as a clotting profile in these things. And then on top of adding in warfarin on top of that, which is also affecting the microbiome, it just completely threw off everything in terms of getting the patient progressing through the therapy. Everything had to be set back. And then luckily enough, she's now off of warfarin, and then the therapy is now starting to ramp up. But that's the major issues that mold can actually do within the cardiovascular function. It can also cause arrhythmia. It can also cause atherosclerotic plaque to build up. And because the ongoing vascular inflammation because of the mold, that can also increase cholesterol production. It also hijacks the liver function anyway. It also increases cholesterol production, causes cell membrane damage. All those things can actually contribute to leading into the condition that I actually had. And then when you're throwing Bartonella on top of that, it's just a perfect storm to occur. So that's what happened to me. My doctor was very smart enough to looking at these things in a bigger way. So the first thing that we started doing was to getting myself detoxed and getting my cell membrane stabilized. And one of the things that I always talk about nowadays, but at that point in time, was putting me on Body Bio PC, so phospholipids, along with their balanced oil to get my cell membrane as well as the vascular inflammation that was happening to dampen that down as quickly as we can, because we didn't know if I would end up having to have a secondary heart attack later on or any of that. And because and the gold standard at that point in time was to put the patients on Mepron along with azithromycin to treat Bartonella infection. But we all know azithromycin can actually cause cardiac issues as cell membrane damage as well as mitochondrial dysfunction. And because I was a cardiac patient to begin with, she didn't want to do any of that. And so she put me on Athong from Byron White and several other drops from them because all the co-infections I was dealing with. So it was intense. The first 3 months, I was bedridden. I had cystic acne everywhere on my face, body full of pain, anxiety levels off the roof, fatigue, couldn't get enough sleep, all those things. And it ended up having to question whether this is the right path that I was doing and what I was even doing was correct. But one thing that I noticed was that as I soon to increase the phospholipids and getting my cell membranes stabilized and creating a correct detox pathway, about month 4, that's when I started having my brain fog disappeared and started having more energy and such. So it took a while. And some people may say, well, that was very short. But for me, at that point in time, dealing with a heart attack on top of all these things, I'm just like, man, this is a hell.
Yeah.
So yeah, that was a lot of things. So I'm a strong believer in that, and on using phospholipids. And one of the things that I also ended up getting was getting IV phosphocholine. That is a major point that could be placed into a person's therapy, not just about stabilizing the cell membrane, but it does a lot more than anything else. So PC can be a biofilm buster. It also helps to get to the overall damages that goes in the DNA and the cell membrane even deeper compared to using oral. So if you're going to be taking oral, where you could end up having to achieve 1 year of improvement, you could actually shorten that even shorter, probably within like 3 to 6 months in doing these things. So when you have a acute issue with the IV, yes, with the IV. So in a huge issue dealing with acute care, that's actually a major thing that could be added on. I also end up getting an IV sodium phenylbutyrate injection as well. So IV sodium phenylbutyrate can be used for mold toxins, and there has been major studies looking at how butyrate itself can actually cleave off the mold toxins off the cell membrane and DNA, because I mean, everybody thinks that the toxins and all the damage occur outside. No. It actually happens within your genetic profile and the epigenetic aspect of it. And that's where the major expression of damage that goes on in your body. And so we have to look at these in a bigger way, that it's not just about the cells. No, it's actually deeper than that within your genetic makeup. So this is where sodium phenylbutyrate ended up having to come through. And surprisingly enough, there is a pharmaceutical company that just came out with a IV sodium phenylbutyrate for treating ALS.
Oh,
so,
wow.
And sodium phenylbutyrate has been looked into treating traumatic brain injury as well as obviously could be used for gut. So if you are not able to get an access to sodium phenylbutyrate as an IV, you could take calcium, magnesium, or sodium butyrate orally. And you may take a long time to get that done, but I put all patients for dealing with mold toxins on a oral form of butyrate to deal with some of the DNA structural damages and detox that I end up having to do very much of an intense therapy on them. So that's one thing that I've done, made a humongous difference. I mean, in terms of like night and day difference. And crazy thing that I experienced, I put a picture on Instagram as well. After 6 months, my cystic acne that I was dealing with disappeared. And as well as I used to also deal with severe gut problem along with halitosis, or bad breath, that disappeared as well. So all these things in terms of the herbal combination, supporting the cell membrane, and also as the fatty acid imbalance that I was dealing with, the body knew what was going on, did its own thing, and things you don't even notice, and then all of a sudden disappeared. So life-changing moments I experienced.
Yeah, that's amazing. And so let's backtrack a little. Could you explain what phospholipids are?
Sure. I mean, that's a lot of people don't know what phospholipid is, and they're like, oh my God, this is so complex. Actually, it is not. So our cells in itself are comprised of bilayer. So just to make it easy, it will be, the aqueous layer on top and then a fatty acid on the bottom. So it's always a bilayer. So 2 layers that forms a cell membrane. Now, the issue is that our cell membrane can get damaged very, very easily from everyday toxins, stress, trauma. Certain EMF can actually cause damage in the cell membrane as well. So if you're having your cell phone next to your body all the time, well, you're going to be incurring cell membrane damages, along with some of the biotoxins such as mold, parasites, Lyme disease, and all the other tick-borne related illness can actually cause that. Viral infections can cause major damage in the cell membrane. Certain medications can cause that as well. Metformin, statin drugs, along with cocaine, obviously That's illicit drug use, but we have to still mention that as well. Amphetamines. So if you are taking ADD medication all the time, well, that's major point that's going to be causing cell membrane damage. So why this is so important is that our epigenetic, I mentioned about the epigenetic. So if you don't know what epigenetic is, for listeners out there, epigenetic is you have a gene expression, and in order for the gene expression to be expressed, everything else that's outside your environment end up having to trigger that. So, but as long as you're able to control it based on your choices that you're making, eating well, drinking well, de-stressing, and getting to your great baseline in terms of detoxing, all those things can actually control your genetic expression. And so taking care of yourself on a daily basis and having a great foundational care is going to really control what the epigenetic expression is going to be. So, Dr. Bruce Lipton does speak about epigenetics very well, and this was cell membrane. So Dr. Bruce Lipton was actually used to work with Dr. Patricia Kane and teaching clinicians utilizing phospholipids for cell membrane damages and epigenetic changes that goes on. Now, he's like the forefather looking at these things in a great way. So why phospholipids are important is that because our cell membrane is comprised of two bilayers, and because of damage that occurs, you need to allow having great profiles of fatty acids to come in to fix that. Well, that's where the phospholipids come through. So phospholipids is not just about phosphocholine, which a lot of people might be aware of, or phosphoserine, was a phospholipid complex. So there's a phosphocholine, phosphoinositol, phosphoethanolamine, and phosphoserine, that four points of it. And why that complex is so important is that the phosphocholine end up having to give you the structure for the outside of the cell membrane, and the inner side, because the bilayer, phosphoethanolamine comprise about 40% of the structure, and then the serine and then the inositol acts as a building block within the cell. Then you also need omega-6 and omega-3. So I like to do more of a 4-to-1 ratio. Everybody's thinking about omega-3, but you need to have a right amount of fatty acid balance. And there's such a misconception about omega-6 because of carnivore MD and all these guys saying that linoleic acid is always bad. No. Oxidized linoleic acid is bad. As long as you have a bioactive linoleic acid in a right ratio between 4-to-1 omega-6 and omega-3, that actually helps to stabilize the inner membrane of the actual cell itself. This is the reason why I end up having to recommend both Body Bio PC complex as well as their balanced oil to give you the internal structure and the outside structure to stabilize. And when you're dealing with chronic illness, so especially like mold toxins, for instance, well, mold in itself damages the cell membrane, and as well as the fact that the body, and especially the cell, undergoes something called a cell danger response. So cell danger response is basically an evolutionary metabolic response to cells and the threats they end up having to come through. So that particular threat or that triggering can be comprised of chemical, physical, or some type of biological or the biotoxin threats. So that's where the mold toxicity comes through. That could also come through in dealing with pH imbalances, EMF, I mentioned about before, psychological trauma, such as physical, emotional traumas that patient might be going through. Maybe you have gone through a very abusive relationship by your parents, or maybe you have gone through, God forbid, some other triggering issue as well. But those all cause a cell danger response. So that emotional release that patient might be dealing with, or maybe you need a limbic retraining and vagal nerve resetting, all those are related to cell danger response. So all the practitioners out there, they're specializing, frequency medicine or in dealing with biotoxins, even in terms of emotional and all these releases. What are we really taking care of? Cell danger response. That's all it is, but it's just different modalities of what it is. So I never say this is the best medicine possible. No, everything comes into play to create a healing process for the patient. So that's where the cell danger response and the phospholipids come into play because, again, cell membrane damage, cell danger response, and one of the key thing that happens during the cell danger response is that the body starts to pump out. It's actually directed by the mitochondria, pump out phospholipids within the cell to lock the cell in. And what that causes a miscommunication or no communication going on within the cell, which can also causes a lockdown, and you can't detox correctly, you're holding onto that toxin. And then as a chronic illness goes through, your phospholipid reserve goes down as well. Now you have a leaky cell membrane. So all that damage comes through. So this is the reason why use of phospholipids is very, very important, in my opinion, in conjunction in working with a chronic ill patients to get them through. Now, obviously, nutritionally, it makes sense, a lot of sense, but also biologically and within the cell in itself, and as well as a mitochondrial function, use of phospholipids is one of the key things that made a humongous impact in myself and as well as my patients and other clinicians that utilize these things correctly.
Wow, that was so much amazing information. I'm so glad you brought up the cell danger response. This is like the future of understanding how our bodies work, I feel like.
Yeah. I've done several lectures of cell danger response. I'm a big fan of Dr. Robert Novier. And so I spoke with Byron twice already on cell danger response. I talked about that several times on my Instagram. And then this October, I'm invited by A4M to talk about cell danger response, along with Dr. Jill Carnahan and Dr. Schumacher and the Dr. Hammond. So, there's going to be major talking point about mitochondrial dysfunction, SIRS, as well as cell danger response that we always have to be looking at. And I think that the future of medicines right now is what's happening.
Yeah.
And we're just riding on that coattail.
Yeah. Wow, that sounds really amazing. Congrats.
Thank you.
Yeah, so basically what you're saying is all of these assaults to our cell membrane can kind of keep the cell danger response stuck in certain aspects. And then it's just a cascade of effect from there. And then yes?
Go ahead, I'm so sorry.
Yeah, okay. And then the phospholipids help to complete that cell danger response cycle back to homeostasis.
So yes and no. So the way that this we need to calm the cell danger response in order for the body to heal. It's the same point in terms of if the person is in a high traumatic, high sympathetic tone, that we have to allow them to be retrained, right? They have to allow them their limbic retraining going on and their sympathetic nervous system to calm down in order for them to, let's just say, start to detox correctly. It's the same concept in looking at this as well. I mentioned before that during a cell danger response, that the phospholipids coming into your cell membrane gets completely locked in. Well, that's orchestrated by your mitochondria. So mitochondria is not just about making energy, it also orchestrates the entire process of inflammatory process in the cell in itself. So why phospholipids is important is that phospholipids and certainly other fatty acids like butyrate comes through and tells the mitochondria to calm down, to help to unlock that particular cell that's been locked in. By adding in that, it also allows the flexibility of the cell membrane to come through. So at least the body starts to let down the guard down. The mitochondria is able to let the guard down, and then overall process of a healing can come through. It's not 100% healing, but that is allowed to do that. But another thing that this PC and phospholipids do very well, it facilitates the detox pathway as well. So especially has a ways to unlock the cell membrane, but also pulling out heavy metals and other toxins. There's a great studies looking at phospholipids and glyphosates. As we know, glyphosates are very hard to detox. I know there's a great product called Glypho-X by Supreme Nutrition, but I like to combine both that and as phospholipids and managing that. But it's so prevalent out there. I don't always hyper focus on that aspect of it. But as long as you have a good baseline of phospholipid reserve in the body and able to allow the flexibility of the cell membrane, the body should be able to detox on its own So I always talk about resiliency, right? I see this all the time where patients end up having to start on some protocol, and they're on the same protocol for several years and they can't get through. Well, if you allow the cell membrane a proper supporting of that deep detox you're looking for and having a great baseline of a phospholipid reserve, the body should be able to handle on its own and have a great ways to handle some stressors in the future. And I'm a speaking proof of that. I had a major mold toxin exposure again about 3 years ago. And the same thing, I didn't do any IVs this time. I ended up having to do very high levels of body bio PC and balanced oil, upper levels about 45 mLs twice a day. And then did a high levels of sodium butyrate and all the other things I was doing, along with the herbal medication. And I was able to clear my mold toxin out on my own in 4 months. So, things work. Why does that work? Well, I had a very good baseline because I was working with the doctor that I was working with back in 2015 in that. So I always say, you got to eat well, you got to take care of your cell membrane, getting your fatty acid balanced out, getting rid of your inflammatory oils, right? Because if you end up having to eat inflammatory oils like canola oil and vegetable oil, that's also a risk factor in terms of damage of cell membrane and making your fatty acid balance even worse. So if you're chronically ill, you're just making your condition worse by eating very bad food.
Right. And so I feel like at this point, everyone's pausing it. They want to go buy these products. Is that a good or bad idea? What do you recommend? Do you recommend always working with somebody? Is there a risk to taking these on your own without guidance?
So that's where I think such a misunderstanding comes through. I think everybody needs a good amount of fatty acid to be intaken by their body, not about omega-3. I don't really particularly recommend doing straight omega-3 these days because of that reason, because you need a well-balanced omega-6 and omega-3. So does everybody need it? I think so. Everybody's dealing with some type of cell danger response, chronic illness, exposure to toxins, and all that. You should actually have a supplementation of phospholipids on a daily basis or weekly basis, whatever you want to do it. But that should be a baseline in that. Now, when you start taking phospholipids, yeah, you're going to be getting some die-off reaction. Why is that? Well, it's actually helping to unlock your cells and having to do a deep detox. And so that's going to cause major issue as well. So when you're starting up PC, for instance, body bio cells in a capsule form, you could start taking 1 to 2 capsules twice a day and slowly increase it. And then when you get to a level that you don't want to swallow so many capsules, you should move into taking a liquid form. So just kind of give you an example, half a teaspoonful of liquid equals to 2 capsules. So if I'm having a patient taking almost 45 to 60 mLs, you can imagine how many capsules they have to swallow. So that's where the highly concentrated liquid form comes into play and works very well in that sense. And it makes a humongous difference. I mean, I had a patient who I took care of. She had a lung cancer that metastasized into her brain as well. And she only had about 3 months to live. And I mean, I wasn't sure if she was going to be alive in 3 months because the shape that she was in and the history and on top of the doctor said, take care of your, ends and you don't have much time to live. So I met with her about May of last year. And all I did was put on a very high intensive PC along with balanced oil, along with some of the detox protocol that I put together and supporting the cell membrane, along with the mitochondrial support. I didn't hear from her 3 months. I thought she was gone. And then 3 months later, she sends me a message saying that, I have a great news for you. My tumor marker is not seen anymore. I don't know what you did. I'm just like, okay.
That's amazing.
And then a year later, I just had a follow-up visit with her in March. And this is the funny story I tell it to other people. She called her oncologist to do a follow-up. And the nurse said, I cannot believe you're still alive.
Wow.
Yeah. And her tumor marker is completely gone now. And she's now she wasn't even able to do any sauna work. She could do She could get into thera stage and do it for 170 degrees for 30 minutes with no issues. She
Wow.
could go for a walk, go for shopping, all that. Yeah, there might be underlying issue with the metastasis, but you know what? She's still alive, she's thriving, and I give all that account for use of phospholipids and really getting that done. And crazy thing about her is that, and at that point in time, I don't know how long she was going to be, well for. So I didn't really bother ordering mold toxin testing. Well, she did it on her own, and she had high levels of trichothecins and other black mold toxins. So mold can cause cancer. We don't look at that deeply enough. So anytime that I see patients like that, I mean, I urge them. I mean, obviously, there's always a budget they have to really look at, but I really encourage them to do a total tox burden testing and seeing what are the environmental toxins along with biotoxins you're dealing with, and get to the root cause. Maybe, maybe there's ways to reverse the issue and other things. Another thing that I added for her therapy was use of reishi mushroom spores from Organo. I ended up having to take 10 capsules twice a day and really do an intense therapy. And she did that for about 3 months. So stuff works.
Yes. Yeah, the reishi spores are one of my favorites for anyone dealing with any sort of immune, really almost any issue.
Yeah, really is. So she's on a maintenance now. So, God bless her, but it's really crazy where I am now versus where I was back in 2015, and then what kind of opportunities actually come up after dealing with our challenges. And that's something that I want to really make a message for people out there. I don't know if you have a lot of practitioners or patients listening to you, but it's just especially for anyone out there dealing with chronic illness, there's always a reason why something happened. And either you take it as a person who's a victim, or a person who is seen as a victory moment in terms of learning about the situation and getting out of it, and then really thriving later on. I'm speaking from experience that healing is possible, and as long as you envision that healing process, that changes the overall frequency in your body, and you're able to achieve what you need to do. It could be hard, but there's ways to do it. So, we always have to work with the right practitioner and guiding you that, and as well as what's happening within your cells and your mitochondria. We have to respect the role of the mitochondria more and more, not just about the biotoxin. I think we focus too much on the parasites, or we focus too much on the biotoxin, but we have to really respect the role of the mitochondria and helping to support that. And I think I'm a strong believer that phospholipids are more of the things that could really be a key point in terms of supporting the mitochondria, reversing a lot of the issues dealing with cell membrane damage, and overall giving the pathway for people to heal.
Yeah, it's very beautiful. And why do you think that they have not really an area of study? Why do you think there's only like one company that's really coming out with products like this?
So the way that BodyBio has is a proprietary extraction process that Dr. Ed Kane ended up having to formulate. So that's the reason why. And the way that they end up having to extract it, I mean, you could get phospholipids from eggs, but in order for you to get the right amount of phospholipids in a very high intensive amount, you have to eat at least a dozen or 2 dozen of eggs. And obviously, because of cholesterol issues, that could be a issue. So they do use soy to extract the phospholipids, and they have a proprietary washing method to get the soy protein off. So people who actually have soy allergies, it won't be much of an issue at all. So that's the reason why their concentration is very high. And I know other companies, they do make so-called quote unquote PC complex, but it's not a true liposomal formula. There's such a misunderstanding about the liposomal as well. There's so many companies now saying that, I have a liposomal vitamin C formula, or I have a liposomal glutathione, etc. But when you look at the nitty-gritty of it, they're only using sunflower lecithin. Lecithin is not a makeup point in dealing with the phospholipid reserve, or at least the liposomal aspect of it. So that's the reason why you have to use some form of phospholipids as to formulating a true liposomal supplement? Well, Body Bio does it very well with that. And there's nothing out there that I've seen. There's some companies that used to have Body Bio manufacture things for them as well. They stopped doing that now, but that's how good their extraction property and their formulation. So that's the reason why I end up having to use it.
Got it. And then what's the difference, or what's the major difference between an IV, a PC, or just taking it orally?
Yeah, that's a very good question, actually. I mentioned before that our cell membrane is comprised of bilayer, and the outer membrane is comprised of PC, just a PC. And then the inner membrane is comprised of phosphoethanolamine, which is comprised of about 40%, followed by phosphoserine and phosphoinositol. This is the reason why use of phospholipid complex is very important. And then when you're dealing with a very chronically and acute issue, use of IVPC is going to help to mend the damage in the outer membrane very quickly, and then you still have to supplement it with the phospholipid complex. And that's the reason why the two things should be combined together.
I see. And is there a risk of any like Herx reactions if you go straight to IV, or it sounds like that's a better option for someone who's dealing with chronic illness?
Yes. You cannot get into IVPC right away because that's a very intensive detox protocol. So to give you an example, if a person is still living in a moldy house and moldy environment, we do not recommend doing IVPC right away. You have to at least and this is the point that I always make, and I think there's a lot of misunderstanding about the mold treatment as well. You still have an underlying colonization of mold. That has to be taken care of first. That's going to cause major influx of gut microbiome imbalance along with leaky gut and other inflammatory cytokines coming through. So that has to be fixed first. So, if you are going straight into IVPC and not addressing that, you're going to have major die-off reaction and throw the person off. So you want to get the baseline first by using oral phospholipids, and as well as addressing the microbiome, or at least the colonizing issue that you might be dealing with. And then maybe about 2 to 3 months later, if you could find the right practitioner who's doing the IVPC, that's all based on body weight as well. That could be added in, followed by there's other protocols that comes through. So IV glutathione, IV leucovorin, and then followed by some of the detox IVs that they might be utilizing. And some of the things that could be coming from Germany. I know Germany does it very well with this. I don't know if you know Dr. Klinghardt, but Dr. Klinghardt utilizes this as well. So this is a mainstream. This should be mainstream medicine, but this is the medicine been around for almost 30, 40 years at this point in time. It's just that it's always been introduced within the functional medical doctors and the training, and that's the reason why it's not really talked about, and there's not much training going on at this point in time. But we are working on something right now, so soon enough that could be available for a lot of practitioners.
Amazing. And then for someone dealing with SIRS or mast cell activation, is this a good protocol to help with that like inflammatory storm that they have going on?
Yeah, absolutely. So for those patients dealing with SIRS and especially mast cell activation, a very underlying cause of parasites, one thing, but then also the mold tox is a major one. So yes, it could be used for that purpose, especially adding in phospholipids. People will notice a humongous difference in their mental fog in about 3 to 4 months, usually what I see in my patients. But in order to make any dent within the fatty acid profile, patient usually have to take about 15 to 30 mLs twice a day to look at that. So there's a study called Kennedy-Krieger red blood cell fatty acid analysis. That is a simple blood test, but it gives a full breakdown of your fatty acid imbalance along with the cell membrane structure. So, some practitioners utilize that test to really do a customized phospholipid therapy. and along with some of the IV PC that might be needing, but that's where it could be all incorporated in dealing with SIRS and as well as a mast cell. And mast cell, I mean, there are other ways to take care of that. So one of the things that I recommend patients to do is a mast cell stabilizing diet, basically taking and getting rid of oxalates. I'm more of a support of doing ketogenic / almost a carnivore diet, because that actually helps to address a lot of the histamine response as long as the patient could tolerate it. And you also get the right amount of phospholipids as long as you get to eat the right animal protein. So I do recommend doing that. And then adding the phospholipids, some of the other herbal protocols you might be needing. You need to pick the right binders as well. I know some people don't like binders. I am a big fan of binders. Picking the right binder is very important. So I'm a big fan of using Takesumi from Supreme Nutrition. And then sometimes I end up having to, mix it with carboxy from Cellcore and such, depending on the patient's level of detox and how well they could tolerate it.
Mm-hmm. Yeah. And I heard you say that you shouldn't mix PC in a binder.
Yes, that's true.
So just take them different times.
Right. Yes.
Okay.
So the reason is I think I was on Emily Moore's post and I answered that question. It is because there is a different polarity charges within the cell membrane structure, and certain binders, we don't have a full data in terms of what is being bind to what. And why this is so important is that the initial things that I've seen, especially Dr. Schumacher's protocol using cholestyramine binds to everything, including mold toxins. But it also binds to, you got to remember why cholestyramine was made. Cholestyramine was made to bind to fat and lowering cholesterol. And especially for bile and gallbladder being an issue. So that's where cholestyramine comes through. So it also rips the phospholipid profile with the cell membrane. So looking at that particular data, now that's a very strong binder, but if you end up having to compare that to, let's just say, Takesumi or carboxy, for instance, which are also very strong binders, and we're talking about polarity charges with the cell membrane, we just don't have enough data to say that you could take both the binder and the PC at the same time. And if it does end up having to bind, if the PC is going to bind to the binders, then you just basically negating the whole effect of the phospholipids. So why do you want to waste your money in doing that? Separate about 4 hours, and that should be enough to do so. And that's exactly what I do with my patients.
Okay, good to know. That's a really important piece of information.
Yeah.
Well, I could probably ask you thousands more questions, but we're about at the
Sure.
hour. So is there anything you'd like to mention? Any last words, any big projects you have coming up you'd like people to know about?
Wow, there's so many things going on. I will be speaking at Cellcore next week and talking about drug-induced mitochondrial dysfunction. So that's a pretty big one. And then in June, I'm invited to Health Optimization Summit to talk about mold toxins and cell membrane damages. So I'll be speaking on stage there as well. So a lot of things going on. Things that I want to really like to do is work with patients one-on-one and get to the root cause issue. So anyone out there that are looking for practitioners or dealing with same conditions I've dealt with and need some pointers and help, I'm definitely here. So patients could definitely visit my Instagram page to make appointments and work with me. But patients could definitely follow me on Instagram and certainly my website, drkimwellness.com. And I really enjoy working with patients. And it's just speaking from my overall healing process, but I want to really empower people that healing is possible as long as we have the right mindset and able to look at this in a bigger way as a moment of improvement and the next level of changes in our life, instead of actually looking at ourselves as a victim.
Mm-hmm. Yeah, very well said. I totally agree.
So, Amanda, thank you so much.
Yes, thank you so much. Thank you everyone for listening, and I will see you all later. Thank you everyone. I am just so thrilled that you're listening to the Healer Revolution podcast. This has been a huge passion project for me and super therapeutic on top of that. helping me to use my voice and connect with other like-minded individuals. So if you're enjoying the podcast, please like and subscribe. Please share on social media or with your audience or friends or loved ones. I truly appreciate it. It does take a lot of time and financial costs to run the podcast, and it is not a moneymaker, let me tell you. So if you are enjoying this, I would truly appreciate your support just by sending me a post, a like, and a subscribe. Thank you so much.